So the indications for cervical disc arthroplasty or artificial disc replacement have really expanded over the years, and I would say that the majority of patients who are a candidate for fusion surgery are actually also a candidate for arthroplasty surgery. So herniated discs in the neck that are compressing the spinal cord or the nerves, causing severe radiating pain, weakness, neurologic symptoms that is refractory to conservative management. Most of those patients, I think, would benefit from a disc arthroplasty. So the crux of the surgery, when we need to perform the surgery, we go in from the front of the neck to remove the disc, remove the piece of the disc which is compressing the spinal cord and the nerves. So once we go in there and successfully achieve that, the patient feels relief, it feels better. The question is, what do we put, once the disc is removed, what are we going to put inside the disc? Because you can't just leave nothing in there. So previously, we'd put a piece of bone or a cage which would sort of fix the disc together, and the bones would sort of grow together, and that's a fusion, and patients do very well. A newer technology, which has been around for a while now, it's probably 10-15 years we have good data on it, is that once the disc comes out, rather than putting in a piece of bone or fusing the two bones together, we put in a moving piece. It preserves that natural motion that the disc was designed to achieve. There are definitely advantages of doing a cervical disc arthroplasty or a disc replacement over a fusion. The fusion surgery involves removing the disc and taking all the pressure off of the nerve, which can be very effective at relieving your pain, but it does limit the motion of the neck somewhat. The other important thing to understand is that patients who have fusions, we know that the discs above and below, where the bone is fused, they take a little more pressure and they take a little more wear and tear, and they're prone to wearing out. So 15 to 20% of patients who have fusions at 10 years tend to need another fusion at another level because those other discs are herniated. So really the goal and the advantage of the arthroplasty is to preserve motion and to preserve the stress and the pressure on the discs above and below. And we know through studies that the pressure on the adjacent segments or the levels above and below where an arthroplasty is done are less than those from a fusion. So as a young patient with a disc herniation in their neck that's not responding to conservative management and having severe pain, I think the arthroplasty has a lot of advantages over a fusion. Most notably, again, you're going to preserve that natural motion and you're going to put less pressure on the discs above and below. So obviously, when you're considering surgery, the thought of having more surgery down the line is very daunting, and you want to try to avoid that as much as possible. So the disc replacement has a good chance of reducing that chance and that risk of needing another surgery.